Assalamualaikum. So now we will talk about chapter 4, health related physical fitness testing and interpretation. So in this chapter we will highlight 5 things that are related to the health fitness, which is body composition, muscular endurance, muscular strength, flexibility and cardiovascular endurance. So in order to have a good health status, you need to have a strong relationship with good health. How to know that you have a good health? Well, it are characterized by an ability to perform daily activities with a vigorous and demonstrate the traits and capacity associate with low risk of premature developments of hypokinetic disease. So basically, hypokinetic disease is a disease where that will come if you do not do any physical movement in a day. Means that you're just laying around with no physical movement. So then you will the chance will be higher for you to get the hypokinetic disease. So what are the purpose of health related fitness testing? It is to educate participants about their present health related fitness status relative to health related standards and age and sex match norms. It also provides data that are helpful in development of exercise prescription to address all fitness components. It also collect baseline and follow-up data that will allow evaluation of progress by exercise program participation. It also motivate participants by establishing a reasonable and attainable fitness goals. And lastly, stratifying and identifying the cardiovascular risk. So what are the basic principles and the guidelines? So to have an ideal related physical fitness, it must be a reliable, valid, relatively inexpensive, and easy to administer. It also should yield results that are indicative of the current state of fitness. It flags to change from physical activity or exercise intervention and be directly comparable to normative data. So we start with body composition. Before collecting data for body composition assessment, the technician must be trained, routinely practice in the technique, and already have demonstrated reliability in his or her measurements, independent of the technique being used. So means that the people that will test you must be trained or a professional. It cannot be done by amateur people. So these are the types of body composition testing. We have under the anthropometric method is body mass index, circumference, skin fold measurements, and under the densitometry is hydrodensitometry. It's an underwater weighing, and plethysmography. Now we will talk about muscular strength and endurance. So muscular strength and endurance are health related fitness components that may improve or maintain the following: our bone mass, which is related to the osteoporosis, our glucose tolerance, which is related to type 2 diabetes, and finally muscular tendinous integrity, which is related to a lower risk of injury, including low back pain. And how do we test our muscular strength? So traditionally we use the 1RM method. However, the multiple repetition movement can be used, such as 4 or 8 times, as a measure of muscular strength, which may allow participants to integrate variation into their training program. And what about muscular endurance? So muscular endurance is the ability to muscle group to execute repeated contraction over a period of sufficient to cause a muscular fatigue or to maintain a specific percentage of the MBC for a prolonged period of time. So the example of testing for muscular endurance is crunches and the maximum number of push-ups. And finally, the flexibility. Flexibility is the ability to move a joint through a complete range of motion. Flexibility depends on a number of specific variables, including the distensibility of the joint capsule, adequate warm-up, and muscle viscosity. Uh, when we talk about flexibility, it also combines a tightness of various other tissue such as ligament and tendons affect the range of motion.